I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Thanks for joining us for today's procedure. Our guests are bariatric surgeon and weight management expert, Dr. Jessica Cutler, and our first guest today, plastics and cosmetic surgeon, Dr. Lauren Nigro. Dr. Nigro, thanks for joining us.
Thanks for having me.
For some background, you earned your medical degree in 2013 from the Rutgers Robert Wood Johnson Medical School?
Yes.
Before beginning a residency in plastic surgery at the Virginia Commonwealth University Health System. And then you joined Mercy in 2022. So kind of a newbie here to Mercy.
Yes, to some degree.
Just recently joined. Is it what you thought it would be?
It is. I actually had a sneak peek of what it would be. I did a fellowship here as well in 2019. So I got a flavor for Mercy and left for a little bit, came back because I liked it so much.
I don't think a lot of people know or understand when we talk about like a fellowship program. You know, what does that mean, like for people who don't know what that means?
Right. So it's not anything like the Lord of the Rings. It has more to do with the subsequent step in your training process. It's an extra year. You can really focus on one thing in particular and fine-tune your skills.
And so the plastic and reconstructive at Mercy has a fellowship program that allows fellows to come in and do that, because not all departments do.
Correct. This was focusing on breast reconstruction using microvascular techniques. This is sewing together very, very small little blood vessels under a microscope.
Now, these are like the deep flap, the tram flap.
Exactly.
And what are those again? I know because I work here, but
Right.
our viewers may not know.
So those are acronyms actually named after the blood vessels that keep that tissue alive. So we are able to move tissue from one part of the body to another and use that for reconstructive purposes. And those flaps, if you will, are named after the blood vessels that we are actually sewing together.
I remember when we first started doing this, and had to be at least 15 or 20 years ago, and it was very, very cutting edge, but the idea seemed to make a lot of sense to people, the idea that you're using the person's own body tissue to, like, in terms of breast reconstruction versus using something artificial. Do you find that in working with patients, you get a positive response to that approach?
Absolutely. For a lot of patients who maybe are hesitant to have implants or patients who can't have implants, it's an excellent option. Again, for people, like you said, that just don't want anything but their own tissue inside of them, it's a very good option.
Now, did you always have an interest in medicine? Was this what you thought you were going to wind up doing, or you came to this through another way, or just how'd you wind up here in
I would say at age 5, I probably didn't want to be a physician, but fast forward, both of my parents are physicians. I've always looked up to them, admired them, thought that the work they've done has been fantastic, very rewarding, very grateful patients, and I wanted a similar career. Both of my parents are not surgeons, and they told me, when I became a surgeon that, it's a little bit different than what they had thought I would choose, but I'm very happy with it. They're very proud of me. It's an excellent career choice for me, and I'm glad I went about the route I did.
It's interesting because one of our past guests, a physician who had decided not to go into surgery, said that the reason he did was he liked dealing with his patients awake. So, but obviously you still get to see your patients awake anyway because you meet with them.
Correct.
Is there anything that's been particularly challenging along this path that you've run into when you decided to make this, not just medicine, but make this particular field, reconstructive surgery, plastic surgery, your focus?
Yep, I think that probably the most challenging part of it is just not realizing how much I would care about things. I tend to be somebody who perseverates over things and worries about things. I'm a mother, I worry constantly about things. I worry about my patients, so I'm always concerned, worrying. Sometimes patients get a diagnosis that isn't always a great diagnosis, and that really bothers me, and caring so much has been something that I've had a hard time grasping and understanding completely.
Do you think women are making more inroads in this particular field?
I think so. I think it's becoming very common for women, yes, absolutely.
Was this, I see prior to going to Rutgers, you had earned a degree at Princeton in molecular biology. Was that something you thought you might, was that a stepping stone to medicine that you intended to take, or you thought like maybe I'll become a microbiologist?
I didn't think I'd be a microbiologist. It's a very natural transition to usually major in some sort of biology-based subject. And so I chose that. I found it fascinating at the time, but did not think I would be a microbiologist. I wanted more direct patient care and patient contact.
Tell me about Dermabond.
Dermabond is a surgical glue that recently myself and a mentor of mine published a paper about discussing the high allergy rate that we've seen with it. It's very commonly used. It's also commonly found in day-to-day products, things that allow for lash extensions, eyelash extensions, nail extensions, and so forth. We did find a higher number than we expected of patients were allergic to it. So since then, I've very much so been hesitant and stopped using it in my practice.
Well, that does happen. Sometimes things don't kind of turn out the way we thought they were going to turn out. I always say that, medicine is sometimes more an art than it is a science, but it's really both, wouldn't you say?
Absolutely. That's all of plastic surgery is a combination of art and science.
So how long have you been in Baltimore?
Since December of this past year.
Oh, so you're still pretty new to the Baltimore experience. What do you think of the city?
I think it's interesting so far. Yeah, I haven't had as much exposure to it, just coming in and out for work with two small young kids at home. I don't get out as much as I otherwise would, but someday in the future, I look forward to it, hoping to catch an O's game.
Well, I did have a friend once who told me that the problem they found with Baltimore, not being native like myself, was that Baltimore seemed to be like a big clique. In other words, like a club that you needed to have membership in. And if you weren't part of that club, it was difficult to break through. So I would say there's a little bit of truth to that. I mean, when people ask you where you went to school, they generally mean, where did you go to high school? Because they figure you're from here. It's an interesting stat that 75% of all Baltimoreans are native Marylanders. So we don't move a lot, or if we move, we come back. But it's got a lot of positives to it. So yes, and then Oriole games and whatnot.
Absolutely.
But what about Mercy? What do you think about Mercy?
I think it's great. Yeah, obviously I wouldn't have come back to work here if I didn't think so, but I've really enjoyed the experience so far. I work with very talented, smart, excellent people. I love the office staff I work with, the OR staff. Everybody is wonderful. We actually have fun at work, which is nice.
That's interesting. You say you have fun at work, because I think people don't think about doctors having fun at work, because usually, at least in my years growing up, hospitals were always depicted as these very serious places where life and death decisions were going on, and surgeons with beads of sweat on their brow and everything else. Everything is so difficult. How do you have fun in the work that you do?
I think you need to smile and laugh a little bit. I think that it's healthy and normal, and I think it shows that you're more human. I think it helps you make better decisions if you're happy in your workplace. So I think everybody just has a lighter mood and when you're in a pleasant mood. And so little things like, telling little jokes, as corny as they may be, can help lighten the mood in the operating room.
Do you guys listen to music and so forth in the OR?
We do, yes. Yes, we do. I'm a country girl, country music lover, despite growing up in New Jersey. So, so that's my music of choice.
I interviewed a physician once. Actually, he was a plastic surgeon too, some years back, and about this same issue. And he said, yes, he liked to listen to music in the OR, but he did not like to listen to classical music. Why do you think that was? Maybe
it made him too tired. I don't know.
It was actually because he felt that he would find himself timing his surgery to the music so that, like, when the crescendo was coming, if he wasn't at that point in his surgery, it felt off, so he didn't like that. He didn't want to make the music dictate the pace of the surgery.
That's really interesting.
So that's, you just never really know. But I guess it's, again, something I don't think people are thinking about too much, like doctors listening to music or having jokes during surgery and so forth. And do you think that's really just because it's what you're familiar with? I mean, how many surgeries do you think you've done even in your short time?
Oh, my goodness.
Hundreds?
Yes, absolutely. Yeah. I think it's something that eventually you start to tune out. You just get so used to it. And then when it's not playing, it feels bizarre. So I think it does help you get a rhythm and a pace, though. I find it very helpful.
Well, it's just that, I mean, in the work that I do, I encourage physicians to do media interviews, and I will see some of them get just almost catatonic at the thought of having to deal with the media. And they're like, oh my goodness, oh my goodness. And it's like, yeah, but you go into the OR and you've got a patient open and you're playing cat's cradle with their insides and, you're talking about the game. To me, that's the pressure situation, not, the interview may feel like you're going to die, but you're not going to. What somebody actually could, and it's the same thing, the same message that, well, this is what we're familiar with. I've had one surgeon tell me that he was never more comfortable than when he was in the OR. Would you feel the same way?
I don't know. Being on a beach with a nice pina colada sounds pretty nice at times, but I think it is a very comforting place. It's, something I'm so inherently familiar with after nearly a decade now of going in and out of the operating room. And I wouldn't say it's necessarily a safe place per se, because, you can have things that are unexpected happen. However, that being said, it is a very familiar place, and so it is like a second home in many ways.
But that's where your training comes in, and having the people around you, the staff around you, so that if something unusual does happen, you're able to deal with it immediately and take care of it.
Yes, I agree with that.
We'll take a break and return after these messages with more Medoscopy.
We've got an excellent team that really specializes in complex reconstructive surgery, particularly complex breast reconstruction.
We offer a very coordinated approach to all kinds of breast cancer care.
I'm involved heavily with breast reconstructions of rebuilding the breast after a mastectomy, fixing breast contour regularities after lumpectomy and radiation.
When a patient undergoes a lumpectomy, they actually remove breast tissue and typically do radiation, which results in scarring. So a patient has two different things. One, loss of some volume, and number two, some scar tissue.
We're able to offer a way of doing reconstruction using a patient's own body tissues without having to affect muscles or other body structures.
From the very first interaction with our office, all the way through to their surgery and their reconstruction, the patient is really the obvious center of our attention.
We have a team approach to taking care of the patients. We try and make it as easy and as seamless as possible for patients when they come in.
We also want to develop a long-term relationship with patients because we want to address what each patient needs and wants.
We are truly a center of excellence. We do groundbreaking work. We do stuff in a very patient-centered way, things that really focus on the patient's experience.
Well, now it's time for a regular feature that we have on our show. It's a bit of a show and tell where we encourage guests to bring an item with them, show to our viewers that may have some kind of special meaning. It might be reflective of your career or just your life in general. Dr. Nigro, what'd you bring?
So this is a little different, but I brought a hammer today. This really is a lot of the inspiration for how I became a plastic surgeon, I think. I was once told falsely that girls can't use tools. And being the stubborn person that I am, I set out to prove that person wrong. So I was heavily involved in woodworking in high school, very artistic throughout high school, very much so liked working with my hands, fixing things, building things. I got a lot of satisfaction out of that. So fast forward about 2 or 3 decades, and here I am as a reconstructive surgeon. I like to rebuild and fix things and build things for patients. We use tools in our practice very frequently. And I think that this really embodies a lot of what I became. Just that determination to prove that person wrong kind of set me on this trajectory where I found what I was passionate about.
Is this particular hammer in play, or is this just
This
one
is a
in general?
vintage hammer that my grandfather used to own. So don't use it anymore because it might fall apart, but, but it is older, yes.
Do you find that that there always seems to be new tools that are coming in your profession, new techniques and so forth? You must be always learning.
Absolutely. So as physicians, we're lifetime learners, but in plastic surgery especially, we're always at the cutting edge of innovation. We're always updating what we do. We're always learning new ways of doing things. Sometimes we're revisiting old ways of doing things, but with a different spin on it. Certainly with microvascular surgery, we're always right on the forefront of what's new and going to be better for patient care.
On the cosmetic side of things, do you occasionally have to deal with patients who maybe are wanting something that really isn't in their best interest, and maybe that may sound good but isn't really going to achieve for them what they want?
Yes, that happens unfortunately quite frequently. One common thing we see is people seeking liposuction or tummy tucks as a method of weight loss, for example. When in reality, it's more of a method to fine-tune and to enhance your appearance. Really, I see it quite frequently and have to remind those patients that that's not the purpose of it and kind of have to redirect them.
When you said weight loss, it reminded me, Mercy, about 2 years ago or so, opened the Maryland Bariatric Center at Mercy. So dealing with patients who have excessive weight and the surgeries that are being done, like gastric bypass and so forth. Are you doing any work with the Bariatric Center? Because generally, I find that when there's a great deal of weight loss, there's a lot of excess skin that has to be dealt with. Is that something where the two centers might be working together?
So we certainly receive a lot of patients that are looking for skin tightening procedures, body contouring procedures in which the extra overhanging or redundant skin needs to be removed. And so yes, we work with them to help enhance that patient's image and how they feel and their satisfaction.
I always found that one of the best things about Mercy is the fact that we have all these different centers and you've got all these different other specialists around you. So if you encounter something or have an issue, you've got, Dr. Singh is right down the hall or whatever it may happen to be. So do you find that to be true?
Yes, and it's very easy to get in touch with people here, which is really nice. It's just usually a cell phone or a phone call away. So that's been fantastic.
You mentioned you've been doing some, like create things. Do you have hobbies where you're...
Oh, if I had time for more hobbies right now, I have a 3-year-old and a 4-month-old at home. So my hobby is trying to sleep when I can. I used to like to, fix things, like I said, and woodwork and whatnot. But otherwise, I haven't gotten as much into that lately. I'm hoping that fast forward a decade from now, I'll be able to dive back in.
Thank you, Dr. Nigro. We'll take a break and we'll be back with our next guest, Dr. Cutler.